everyone. Thank you for taking the time to attend today's session. It's going to last about 70 minutes, and I'm going to talk to you about this revolutionary device called TLCL. So in the very first instance, I'm going to show you what's inside the box of this really exciting product. So when you get the delivery from TLCL or your distributors, you get the TeoLink, the body of the TeosyalPen, and the battery. And the TeoLink is a syringe holder for the improvement of the handling of the pen as well as the ergonomics of the pen. So we'll put the TeoLink away and I'll show you what's inside the box of this TLCL It's the world's first and only motorized device for injecting dermal fillers. When you get the delivery from TLCL, you get this really nice packaging. And it's consistent with premium product from TLCL. It's very well packaged together. You have an instruction manual which is self-explanatory, and you also inside the box get an instruction manual that comes in different languages. So it's very self-explanatory. It's the world's first and only cordless motorized device that's been specifically engineered for injecting dermal filler. And towards the second half of the video, I'll show you the different ways of using the device with injecting techniques. So that's the body of the TeosyalPen. It comes in 2 programs and 3 speeds. At the very start, you want to take the little stopper away, and that's replaced with a battery. And the battery comes with a device as well when you buy the TeoLink. You will assemble the battery very gently, and then you put it aside. This is the TeoLink. TeoLink is a syringe holder, and the function of the syringe holder is to improve the ergonomics and handling of the TeosyalPen. And it's also where you will attach the syringe as well. And there are 2 latches where you will click the syringe holder into the pen. First of all, you want to remove the plunger rod. And you will then remove the finger range, and you will take the rubber stopper away. There are 2 ways of attaching the syringe into the syringe holder. You can either attach the hub of the needle first, or you can attach it after you've assembled it into the syringe holder. So this is how you will assemble it and make sure that it's nice and snug. And the 2 latches there will have to go through the 2 little holes on the side, and you will hear a click. And that's nice and secure, and you can start injecting. And you can also use it with cannula. For those who are just joining us, this is the world's first and only motorized and cordless device specifically engineered for injecting dermal filler. And what you will get from it is very smooth, consistent, and homogeneous flow. And that's the on and off button. It comes in 2 programs, and each program comes in 3 speed. You can either use linear threading or boluses, and it's so ergonomically designed that you can click and inject regardless of how you handle the device. So there are 3 modes, 3 speeds. That's boluses and linear threading, and it's color coded as well. So it's a lot easier for you to recognize what modes you are using. Like I say, it's the world's first and only cordless device for injecting dermal filler. It gives you a very smooth, consistent, accurate and precise quantity of filler and full control as a clinician. So for those who are a little bit skeptical about it because you are a very experienced injector, be very open about this device and try it and approach your distributors and try the device. A lot of people say to me they are very experienced injectors, they are very good with handling of syringes, they don't need a device. But we are not robots, and we are never as good as a robot. So if you want to detach the device, you want to switch the device off, and then it's very quickly, you press on the latch and it will just come off. What I'm going to do is now I'm going to show you how to use the device. It lasts about 12 minutes. I'll show you how to use the device for the lips, infraorbital floor, nasolabial folds, and other parts of the face as well. So this is 2-point eye lift. It's a technique that I constructed 2.5 years ago, exclusively for TLCL's Redensity 2. And I use a cannula. This is a 25 gauge 1.5-inch cannula attached to the TLCL It's the size of this, so it's cordless, it's very small, very ergonomic. It offers clinicians a very smooth, predictable, consistent, homogeneous quantity of filler, which your hand is not capable of offering you. So you inject, and it's very straightforward. It takes into consideration the loss of volume in the infraorbital floor. As you know, when we age, two things happen in the infraorbital region. One is the widening of the orbit from oval to rhomboidal, and second is the flattening of the infraorbital floor. So in this part of the face is very delicate, and the challenge with all the clinicians is that trying to provide a procedure that you will not cause any lumpiness, and it's safe and quick. So the 2-point eyelid has been constructed in such a way that it's quick, it's safe, and it's very, very straightforward. And now with the use of TeosyalPen, it offers you a very consistent, smooth, predictable delivery of the quantity of filler you want without the lumps and bumps. Second procedure is, now with TeosyalPen, one of the complexities of lip enhancement is pain, isn't it? That's because when we inject the filler, the expansion of the tissues can cause discomfort. With TeosyalPen, the delivery of the gel is so smooth that it doesn't stretch the tissues as much as if you use a manual syringe. So it translates in reality to far less pain, less discomfort, and far fewer side effects because of less tissue reaction. And when you're sculpting the border, the vermilion border of somebody's lips, you will like this product because it's so smooth and it's so consistent. As you can see, the patient showed very little discomfort or no discomfort at all. There is no lidocaine, no local anesthetic injection, and no use of topical anesthetics. But what it gives you is this really sculpted, contoured, and very smooth border. The speed I'm using is the medium grade. It's a very ergonomic device. Whether you're left-handed or whether you're right-handed, it doesn't really matter. You can use it however way you want it. You can hold the pen either this way, or you can hold it this way, or you can hold it this way when you're doing boluses. It's designed in such a way that you don't necessarily need to click it here. You can click it here and you can activate the device. So it's very, very well designed. For those who just joined us, this is TeosyalPen. It's the world's first and arguably only cordless and motorized gadget for injecting dermal filler. What it offers clinician is it uses far less product. It's very smooth, very consistent, and it's very predictable. For patients, it offers a procedure with less pain, less discomfort, less side effects, and a more natural result. As you can see, you can change the syringe, the needle, to something that's much smaller than the one that comes with the packaging. Because now the motorized device will push the filler out for you. You don't need to push it so hard. So you can change. What I normally do is I change the needle to 2 sizes smaller than what comes with the packaging. And the motorized device will deliver a very smooth, consistent flow for you. So this procedure is showcasing the potential of TeosyalPen, offering you a very smooth and very sculpted and very concise and accurate delivery of the quantity of filler you want. It comes in 2 speeds, 2 programs and 3 speeds, linear threading and boluses. So when you're doing, say, redensity 1 for rejuvenation of the skin, you can deliver a very concise, predictable quantity of filler, of boluses filler, and as you go along. So you don't need to look at the plunger, you can concentrate on the artistic side of the delivery of the procedure. For those who just joined us, this is TeosyalPen. I'm using a cordless device to inject dermal filler. What it offers is a very smooth, homogeneous, consistent, and accurate delivery of dermal filler. It offers very little discomfort and very, very few side effects as well. So from a patient's point of view, you're offering them an advanced device with fewer side effects, less pain, and from a clinician's point of view, it's more predictable. You use less product, and you can concentrate on the artistic side of the procedure. As you can see, it's a very well-engineered product with clinicians in mind. You can use it either with your left hand or your right hand. It doesn't really matter. And it's originally engineered in Switzerland, and for those who are not familiar with TLCL, it's one of the world's most popular dermal filler brands. And consistent with TLCL being a premium brand, this device is very well designed. It's very light, and it's very ergonomic. You can hold it either like that and click it this way, or you can hold it this way and click it this way, or you can hold it and click it at the front of the device. So it's very ergonomic. Whether you're left or right-handed, you can still use it without any difficulty at all. So this is the third procedure I'm going to show you. It's nasolabial fold with cannula. As you know, one of the advantages of cannula is it offers you a smoother, more consistent flow of filler. But now you can combine it with TeosyalPen. It offers you even more consistency and even smoother delivery of the dermal filler. We want to be nice and gentle, so what it offers you is fewer side effects, less pain, less discomfort, and a more consistent, smoother result because it's a gadget. For those clinicians who are a little bit skeptical about it because you've been injecting for a few years and you have very well control of the plunger and the syringe, do not be skeptical about it. Do give this device a chance. And I was the same when I was presented with this device, that everyone that we have presented this device to, they have been quite skeptical about it. But what this device can do for you is something that your hands is not capable of. Because although you might have very good control of the plunger, but it's never going to be as precise and as accurate as a device. So for those who are just walking past and just join us, this is TLCL It just came onto the market not very long ago. It's the world's first and motorized device, exclusively engineered for injecting dermal filler. And in a very delicate part of the face, such as the perioral and periorbital region, you will like this pen because it really offers you a very precise, very consistent, predictable flow of the quantity of filler you want. And I'm using a linear threading mode. It comes in 2 modes, linear threading and bolus, and each mode it comes in 3 different speeds. So you can use it with different types, different grades of fillers, and for different indications. When you need boluses, you just click on the bolus, and if you need linear threading mode, you just click on the linear threading mode. One of the most challenging part of aesthetic medicine is the periorbital rejuvenation, and one of the complications we face a lot is the lumpiness as well as side effects. So with TeosyalPen, what you're seeing is the 2-point eye lift is a procedure, a technique I constructed 2.5 years ago with Redensity 2 in mind, offering you a very straightforward technique to rejuvenate the infraorbital floor. And it's a TeosyalPen I'm using, and it's a 25 gauge 1-inch cannula. You only need 2 puncture sites, and that accounts for the widening of the orbit as well as flattening of the infraorbital floor as a result of the aging process. And then with the use of TeosyalPen, what it offers you is a very smooth delivery of the filler in this part of the face, and it minimizes the risk of lumpiness and uneven delivery and deposition of the filler. So it makes it very straightforward for all of you. You can inject it with a lot of confidence, knowing that the filler that will come through the cannula will be nice and smooth. So this is on the other side, the left side. You tunnel the skin. And for those who are just joining us, this is the use of TLCL for periorbital rejuvenation. And it's a technique I constructed 2.5 years ago called 2-point eye lift. With TeosyalPen, what it does is it offers you, again, a very homogeneous, consistent delivery of a fixed quantity of hyaluronic acid dermal filler. It fits any 1 cc, 1 milliliter syringe, and is ergonomic, exclusively designed and engineered for injecting dermal filler. And for patients, it offers your patients less pain, fewer side effects, more confidence. For clinicians, it offers you a gadget that will use far less product, between 10 to 30%, more consistent, predictable flow of delivery of fixed quantity of filler. It comes in 2 programs, 3 speeds, so you can chop and change. If you want linear threading, it comes in linear threading and 3 separate speeds for complete control of the delivery of fixed quantity of filler. And if you want boluses, it comes in 3 separate speeds as well. So for your patient, they will perceive the procedure as more comfortable, and they will have more confidence in the procedure. And for clinicians, it will offer you a gadget that will use far less product, between 10 to 30%. And in summary, this is a gadget that is worth looking into, and if you have distributors in your country, do approach them and ask them to demonstrate the use of these revolutionary gadgets. Thank you.